So before starting a medication, your doctor is likely going to want you to have lifestyle changes. What does that mean? Ultimately, you're going to exercise more. You're going to reduce your sodium intake or your salt intake, and you're going to try to lose a few pounds.
Sodium and lowering sodium are quite important in a diet that is aiming toward lowering someone's blood pressure, because we know that a high sodium diet can actually increase blood pressure.
So we want to be getting more fruits and vegetables, which are really rich in potassium, and potassium helps to balance out sodium levels.
If you lose about 5 pounds, you could actually have a 5-point drop in your blood pressure reading. So if you're somebody that's even at that very borderline range, you could drop your numbers substantially.
If you have high blood pressure, you definitely need to be doing cardio exercise, because that will help improve the quality of your blood vessels so that the blood can flow more freely through them. But you also might want to do some meditative work like gentle stretching or yoga, something that will help with stress reduction in order to be less stressed, which is also a risk factor for high blood pressure.
Smoking is another risk factor that we think about that puts you at a much higher risk of having elevated blood pressure.
For sure, with blood pressure, we want to make sure that people are watching their alcohol intake and certainly avoiding excess alcohol use. If patient is in the early stages of high blood pressure, for example, if the blood pressure is either borderline or it's on the low end of hypertension, usually we can either get away with lifestyle modifications, meaning if a patient loses weight.
If after a few months we notice that despite the changes in the lifestyle, our blood pressure remains high, we then start to talk about initiating medications.